to have Donna Benton here to present to you. Donna is a, uh, a big figure in California in the caregiving world. And you see her credentials here. She's based at the USC Leonard School of Gerontology, where she has several roles. She was recently helped to shape the master plan for aging, and you'll hear about that. She was on the long-term services and supports team and the equity and inclusion team, as well as the master plan oversight team. And she's continuing her role with the master plan in the caregiving arena. And one of the things about Donna is she is a lifelong learner. And that's something that she and I have in common, and she has in common with all of you. Donna is a real fan of the Village movement, and really looking forward to continuing a relationship with Dr. Benton as we move forward with our caregiving program. So with that, I'm going to stop the share. We can see everybody here. And I'm going to turn it over to her. And actually the recording is working, so yay. And I'll keep, Donna, I'll admit people to the room while you start your talk.
Great, thank you. Thank you so much, Charlotte. Hi, everybody, and thank you for this invitation today. And I'm really very happy to be able to talk with a larger community of the villages. It's such a wonderful concept, and I think that for our time, it's something that helped us through this pandemic. For those of us that are, if you're in a village, I think that that's kind of what helps save many people from social isolation during this time. And so that's why I titled this "We Need Each Other." And because throughout our lifespan, we don't even, we kind of take for granted that we're going to do childcare. We take for granted that we're going to help our spouses or our siblings, but we forget that this starts at the very early stages of our lives and continues throughout. Because most people, when you ask, well, who's going to take care of you as you get older, or if you had talked to your relatives a long time ago, they probably said, oh, well, it'll be somebody in my family. And so that's kind of where this whole concept of we need each other. We have always worked, humans have worked together in this kind of village model, our friends and our neighbors. And so caregiving is something that's quite natural to all of us. Oops. So now let's see. Good. So today, what I'm just going to do, and I'm just going to have three main themes, and we'll have some time to talk together. And that's through the chat. Sorry, because there are so many people. I think the chat feature will work better today to have your comments, but feel free to comment in the meantime, and while I'm talking, if there's something you want to get out. And then I think Charlotte said that she would kind of bring those forward and monitor the chat room. I'm also going to tell you a little bit about how I feel that the villages can partner with the California Caregiver Resource Centers that are located throughout this state, and then spend a little time on the master plan for aging. So let me just start with how I think the lineup with the villages. So I went on the village website. Where else do you go for information sometimes? And it really, what it said is, what stood out to me is it said the villages can really be that important support that helps people stay healthy in the community. And you know what? The studies and research show that the health community, actually doctors and nurses, really feel that people that have some type of caregiver come out with better healthcare outcomes. So what we're doing within the village is also perceived as critical and important within the healthcare community, and for overall well-being for us as people. So, and you can see like 8 out of 10 patients who are this, when they look at 8 out of 10 of their patients, they were surprised that the caregivers were part of just everybody's life after the age of 50. And I would say one of the things is that really it's part of the fabric. I like this quote that says that caregivers, both paid and unpaid, hold together the fabric of our society. And this is why you have to honor, support, and recognize being a caregiver. And the interesting thing is, most of us don't think of ourselves as caregivers. We don't think of ourselves as caregivers because it's what we do as a adult child, as a spouse, as a sibling, as a friend, and as a neighbor. So we don't label ourselves caregivers. We label ourselves in the other way, and we don't think of the role as of caregiver as primary. Most people tend to think of caregiver as, that's that person that you pay for. But really, caregiving, our whole foundation of the long-term care services system, meaning who cares for people in the community where everyone is living. Well, that whole foundation really is built upon the parents and siblings and spouses and friends and family who provide most of the care in the community. And you can see that I don't like to read off the slide, so I leave the slide up for you to read. But I think one thing to point out is that 14% of people who live in the community are being helped and cared for by friends or neighbors or non-relatives. And that's, again, probably you as part of a village are part of that 14% of care for your neighbors and friends. The other thing that I think is to point out in this statistic is that this is labor and care and volunteerism that accounts for $470 billion. And that number's gone up to 480-ish right now in a more recent survey in terms of economic value of family caregiving. And that means that when we um, the caregiving for that economic value is more than anything that we pay in Medicare, Medi-Cal, and out-of-pocket hospitalizations. All of that cost is actually not as much as what the economic value is of as we care for our friends and neighbors and relatives. California, not surprising, we have a lot of caregivers. It says 2 million, but actually in the more recent statistics, which I have to update here, it's now up to almost 4 million Californians are providing care for somebody over the age of 55. The other thing is, of course, is that the profile for caregivers is very diverse. It hits 1 in 4 families. Caregiving, not surprising, is still primarily done by women, but 25, I've seen data that has as high as 40% of caregivers are identify as male, and as low as 25%. But either way, it's still primarily done by women. And across different ethnic groups, the rate of caregiving may be slightly higher, but overall, it's somewhere between 80 and 90% of caregiving is done within families of all ethnic backgrounds.
Mm.
And then another figure that, because we recently have a little bit of information, we know that at least 9% of family caregivers are LGBTQ. If you want to kind of squish everyone together and get at the average profile, caregivers tend to be around 49, 50 years old. So they're usually working full time. They might be married. You can see the household income, and they're usually caring on average for somebody 69. But that number, of course, is going up. I think what's important to remember about caregiving and the people you meet is that this is not something that's usually a short term journey. It's usually about 4 years. It's another 24 hours a week. And this is on top of being, working full time. And people are really providing a lot of care and for the person. And ADLs and IEDLs, that stands for activities of daily living, which are things like bathing and dressing and toileting, but instrumental activities of daily living, which is what you might be helping out a neighbor with, going to grocery stores, doing transportation, helping with gardening and household tasks, financial bills. And that's really where a lot of, in the early stages or as friends and family, we might be helping out with what are called instrumental activities of daily living, meaning that if you can't do those things, many times that's going to impact your quality of life. So, but ADLs are more personal quality, personal activities, and the others are all the things that you just do every day in order to get through your daily life. The other thing that I think is important to remember is that we all generations provide care. The Gen Xers, people talk a lot about baby boomers, and many of us are in the boomers or the boomer age group. But Gen Xers, which are anyone born between 1965 and 1980, um, they're also a high proportion of family caregiving. And if you can see that they're also 15% of these adults are also caring for or raising a minor child, and at some point in their life they feel that they know that they're going to be responsible for caring for an aging parent, family member, or a neighbor. So when you look at the Gen Xers, that that group is now beginning to move into becoming the larger percentage of people who are providing care. And below the Gen Xers, um, sorry, below the Gen Xers are the next generation of caregivers, and those are the ones that are, somewhere born after before between 1970s and or 65 and between 65 and 80. And those groups, sometimes we forget that the younger people in their 20s or 30s are helping out with caregiving. And maybe even some of you might have grown up when you were a younger child, below the age of 18. And maybe you were the one that regularly helped with watching your grandparent, or taking over some food for your grandparent, or doing a little shopping, or helping a parent during that time. So at some point, we have probably contributed to being a caregiver throughout our lifetime. And then the responsibilities become more and more. But this is just something that's a normal part. Um, but what's so hard about being a caregiver is that, as I said, none of us self identify as caregivers. So when you're helping out a family, or if you're doing this under the village model, you might be helping somebody who is a caregiver, and you're helping them by going to the store during this, say during the pandemic. Sometimes people, they were afraid they couldn't go to the store because they were at higher risk for the person they're caring for, or they couldn't leave that person alone. So you might have been helping out, or you might have been coming in to help, or helping with the gardening and things that were kind of difficult for the person in the community. So you've been doing some level of friend caregiving on a consistent basis, and you probably have caregivers. Could be yourself, could be one of some friend or in the village, and they need some type of support. And the reason that it's important to recognize caregiving is that they found that in research, and this has stayed pretty consistent, that a little less than half of caregivers, because of the different strains that are placed on having to care for themselves, and trying to balance all of the juggling that takes place with all the different responsibilities. 46% of caregivers are can be seen as clinically depressed. Now that doesn't mean 46% are getting any kind of therapy, but some of that depression is related to this um, overwhelming responsibilities. And that nationally, that when they ask people how the caregiving has impacted them, they really see that it's having a strain on their physical health. So not only the person that they're helping, their relative, but also themselves, you can become strained and squeezed. The other thing is this is across all incomes. Sometimes people, you may think, oh well, I have enough money where it's not going to impact me. Well, higher incomes tend to be more squeezed. They're more likely to probably have maybe children in college and working and trying to do caregiving. So as your income goes up, it doesn't mean that you can't feel some of the pressures of being a caregiver. It may be easier to get some alternative help, but the help that you're getting isn't doesn't take you away from the responsibility of how you feel that you have to manage all of that person's finances, or you're helping with their food or coordinating all the services. So the strains are not just related to the physical um, helping somebody, but it's also related to your emotional involvement with your relative or friend. So, and as I said, I'm going to skip past this because we know that family caregiving, as I've said over and over, is it's really a responsibility that most people feel that they're going to be doing it, and they do feel that it is their responsibility to even help out financially a parent who needs help. The reason that villages have become, and this whole the village model is very important, is that we have more, the family structure has changed a lot. We have more people who don't have family members that are close. We have an increase in single family households, or we have an increase in people that only may have one adult child, or a sibling. So these families have gotten smaller, and there's not a lot of support over the years. We're seeing that the number of people who can care for a family member has changed, and people are living further apart. So the whole family structure means that it's really um, imperative that we become a village, as you have, and work with family and friends, and work together in that village to help support somebody who may not have support, even if they do have family members. And this trend is going to continue because families are getting smaller. The other thing around caregiving is that, as I said, it's really has multiple impacts on our health and well-being. People you don't sleep very well, the caregiver may not be eating well, not taking care of themselves through exercise and diet. They feel a sense of isolation and loneliness, and so it becomes very important to identify people that might be a family caregiver and see what you can do within your community to support the caregiver. Um, but I always like to end and remind people, like I keep talking about all of the issues, but remember that the primary reward is that this is something that all of us value to some degree. It usually brings a closeness that may have slipped away over the years, and people get to rediscover who they are, who that the person they're caring for. It comes with love and respect and a sense of giving back, and those are just a few of the rewards of being a caregiver. So most of us are not trying to get out of the role of caregiver, and probably that's why we don't even think of ourselves as a caregiver. I'm going to stop here for a second. Are there any things that came up in the chat? Because I'm not watching the chat.
Yeah,
Or
so
any
I'm watching the chat, and one of the questions was, how do you define a caregiver specifically?
specifically for an informal caregiver is anyone who is helping somebody else with any activities, from when you might just be helping somebody with grocery store, going to transportation. You don't have to be a relative. You can be, and so I call it family caregiving, but that's family or friend, or so whoever we choose by blood or affinity, so who we choose to affiliate with. And sometimes it's just the emotional caring for somebody and being worried about their health and trying to help them out. So that's where caregiving often begins, is just thinking about, like, I'm going to call this person every day or every other day to check in on them. And that's usually the beginning of the journey, is when you begin to be concerned and you want to check in on someone. And then it can, you can maybe be picking up medications, you can be helping set up medications, you can um, all the way to actually helping somebody get in and out of bed, or taking them to doctor's appointments, or washing their hair for them. In some way, we are all doing some level of caregiving. And when you feel that that is really a responsibility that you've taken on for the long haul to help someone. I hope that answers that question.
Great. Um, there are two other questions before we
Mhm.
move on. One is that you stated that I think around 46% of caregivers reported clinical depression. And so there were two questions related to that statistic, which maybe I got a little bit wrong. But one is, what is clinical depression? And then the other question is this family caregivers, or is this caregivers as a group?
That's family caregivers.
Okay.
So not the paid professionals. So the ones that people who are paid, we're not counting that population. And so this data that I'm talking about today has nothing, it's not from data from anyone who's like a paid professional caregiver or paid home health worker. And that 46% for clinical. So these are people that are exhibiting where they've, by, if you, by the DSM-3, or no, DSM-3, my goodness. I think we're now in DSM 5, 5 now, where it's been 2 weeks or more of specific symptoms around depression, so that you have a lack of interest in things around you, sadness, crying, lack of energy. There's a whole clinical that has to be there for several weeks, and very persistent, that would be seen as clinical depression. Now, as I said, just those are the clinical symptoms. And so, which means that that person could benefit from some type of therapeutic intervention. So yeah, it's really, that's what I mean by clinical depression. So it's not just normal feelings of sadness or loneliness or like that. This is where it's very persistent, and it impacts your day to day ability, your cognition, your thinking, your energy level from day to day for persistently for 2 weeks or more.
And then there was a question about what percentage of family caregivers are giving, uh, are, are caring for someone with dementia.
Um, the probably, I think the last thing, if you look at caregivers from 18 up, the majority, somewhere around 60%, are caring for somebody with some type of dementia. So dementia can be, it could be Parkinson's, Alzheimer's, stroke, so any type of dementia. So the majority is, I think it's 60% or more, but don't quote me on that statistic. I could get you the exact number, but it is the majority of people. And those are the higher intensity caregiving. But there are people that are caregiving for people that don't have any type of dementia, but just may have chronic health problems.
Great. And just, there were a couple of comments I wanted to highlight. One was someone wrote in, oh my God, there are other people like me. And I do hope that part of what's happening is a self-recognition and the understanding that you're part of a larger community of people, and a larger, and that there are resources. And Dr. Benton is going to talk about a specific resource in just a minute. But then the last comment I wanted to highlight is that Someone wrote in, it seems like self-care is very important, very important practice for the caregiver. Do you have some comments about that?
Absolutely. I think that it's absolutely critical. That's one of the things that, in order to keep your health, that you need some type of break and respite, and self-care becomes very important. And it's usually the last thing that caregivers tend to think about is self-care. And particularly, I'm so glad that someone recognized themselves as a caregiver, because 1 out of every 4 people are caregivers. But again, we tend not to self identify as caregivers. So you can be a caregiver and a spouse. You can be a caregiver and a friend, and a caregiver and a sibling. So, the reason I want people to begin to think of themselves as caregivers is because as a group, you'll have a stronger voice. And we'll talk about that when the next section. So, I'm just going to go through, spend about 5 minutes to talk to you about the resource we have here in California, and that's the California Caregiver Resource Centers. I run the USC LA Caregiver Resource Center, and so that's our local one that's in here in LA and serves all of LA County. So even though the name says USC, it's not just for the USC community; it's for all of LA County, and that's county, city, state, every community in LA can use the resource centers. And throughout California, the entire system is called the California Caregiver Resource Center System. And there are 10, there are 11 sites, or 10 plus LA, and they cover from tip to tip, border to border, all of California. So there's this, you can go on the California Caregiver website, put in your zip code, and find your caregiver resource center. And so the resource centers are there to help families and communities master the challenges of caring for a person with any kind of brain impairing condition, um, like Alzheimer's, stroke, Parkinson's, and chronic health issues. So we have a very broad mission. We've been around for going on 36 years now, and funded through the state of California. And really, the key thing that I think stands out about all of these centers, and why we have a consistent way of helping family caregivers, is that we do a standardized, uniform assessment. And what that means is we ask everyone the same set of questions so that we can really get an individualized plan of care for the person who calls us. And usually, no one calls us to say that they're calling because they're a caregiver, because people don't think of themselves. But they will call and say, I am caring for my mother, my father, who has Alzheimer's, who had a stroke, who has cancer, who has fallen many times. People, the person calling is usually calling about the person they're caring for. And that's okay. We know that that's how these calls begin. What we do in turn is talk to them about that situation, and then talk to them about who they are and how they want to get help for themselves, so that they can be more less challenged by the caregiving journey. So that's where we ask a lot of questions. We do an assessment, and then we come up with a care plan. So, and the care plan leads to services. Everything can be done online now. Of course, with the pandemic, we are providing all of the services online, and that's including support groups, education and training programs. We have case management, so that everybody is assigned a individual who is with them throughout their care journey for one-on-one consultation, so that you can call your what's called our family consultant or family care navigator. You can call them anytime after you've joined the Caregiver Resource Center, and then they can call and say, "Oh, mom had I don't know what to do about this medication, or how do I talk to this doctor, or what is this, I heard about this new medication. Is that any good, or where can I find food? Whatever you need, you get a family consultant. Because this is our caregiver resource centers are funded through the state of California. We don't actually have, there's no income level required to use services. So for anybody can call. There's the only geographic limitations are that you work with the center that covers your geographic where you live. So that's why I said, based on your zip code, you'll be at one of the 11 caregiver resource centers. We do support groups online. We have, as I said, everything is done through an individualized care plan, and that's reassessed as you continue your caregiving. Because one thing with dementia is that we know that the dementia going to change over time, and you may need different services as the person you're caring for moves along. So you need different information, different education, different skills. And so we have programs to help build skills for you as a caregiver. We also do a lot around self care, helping the caregiver understand the importance of self care, providing respite. And we do provide respite for people. During the pandemic, we found that, obviously people were concerned about someone else coming into their home. So they didn't want to use the respite care services, understandably. And so now instead, we've been providing meals to the caregiver so that at least they don't have to cook maybe every meal, so they're getting home delivered meals during this time for them so that they can have a little less responsibility. We've able to get personal protective equipment in the early parts of the pandemic, and we still have that available to help caregivers, so that sometimes it's very hard to get all of those PPEs and you have to change them out. And so we have things like that during the pandemic, but everything is individualized. So one person may need a support group, another may need to go to a special class to understand Alzheimer's disease, or maybe you need more legal information, and we can help pay toward legal and long-term care services. So it really will depend on what starts with back there, what I talked about, which is the assessment, because we want to know what are your risks as a caregiver, what do you need, what are your strengths, because every caregiver, if you've been caregiving, you have strengths. You may not recognize them, and you also have preferences on how you want to be a caregiver. But one of the things is sometimes it's hard. They don't want to ask for help. And so that's why I always like this ad from AARP, saying that you don't have to be so strong, that you can have help and support. And so that's where the caregiver resource centers come into play. And we make sure that we link you to other community resources when we can't, if we don't have the resource, we're going to make sure that you get linked to other resources. So this is how, and everything either it starts, the fastest way, of course, now is to go onto the web. We have a portal for CareNav. It's a confidential portal. If you think of how you contact your doctor and how you work with your doctor for making appointments, getting information, that's the same kind of portal that we have, which is called CareNav. And that portal allows you to save all of the information that you learn, the classes, the contacts and information in a what's called a HIPAA compliant platform, so that it's all so that no one else can go in and look at your information. And that's how you can talk to your family consultant through the portal, so that everything stays confidential. But everything can start with either going onto the website, or we can start the process through a phone call. And then this is just, again, a reminder of all the types of services that we provide. And again, there's no fees. Of course, all the centers are not for profit, so donations are always welcome for services. And some things may have a small suggested donation or fee attached, but it's usually, a few bucks here and there. So that's it for the caregiver resource centers. And I think the key thing is that people tend to think of caregiving. It used to be we were kind of rural, and we we think of family as this is a family issue. We aren't going to talk about what we have to do outside of the family, but we really can't see this anymore as just a private family only issue. We all need help. We all need services. We all need to really become part of the village around us and work with our families and friends. Um, I already talked about some of these, and I I like the idea that, for the villages, what you're really bringing is that you're those few caring people that are changing the world. Because without help and volunteering, many of us would be very isolated, and particularly if you're doing family caregiving, even though it's very common, most people feel like they're alone in doing this. So I'm going to go on to the master plan for aging, Charlotte, unless you think I should take some more questions.
I just wanted to make a comment, and I want to thank you so much for bringing this resource forward. And we are going to make sure as we move through our caregiving series that we're putting the Caregiver Resource Centers front and center in terms of resources that the village should be connected with. And given that they're taxpayer funded and free, and they provide this rich set of resources, I think a next step for all the villages would be to reach out and make a formal relationship. So I just wanted to hold that up for those of you who are village leaders, and for those of you who are caregivers or no caregivers. It sounds like it's quite easy to get involved. I know that I'm a long distance caregiver for my 88 and 89-year-old parents, so I am definitely going to take advantage of these resources. And
So
I
if you,
also just, oh, go ahead.
no, I was going to say that's a wonderful example for yourself, because who you're caring for, if you live in California and you're the caregiver, it doesn't really it doesn't matter if you're long distance like yourself. Our services are for you, and we'll
Yes,
help you connect to the services that are for your relative, where in whatever state they're in.
great. So I hope all of you heard that. And then I just want to underscore that the terminology family caregiver and family care navigator, when we look at the mission that you shared, Donna, at the beginning of this set of slides, it talks about family and community. And that continuum where we're talking about friends caring for friends as well
Right.
as relatives. Great.
Yes, absolutely. And that's the one thing, I use the term family, but it's always family and friends. So friends,
Yes.
you're eligible if you are ongoing and caring for somebody who is a friend. I happen to be a caregiver right now to a friend who I've known since I was about 20, so over 40 years. And I'm the primary caregiver for this person, who's for my friend. And so, as I said, it's by blood or affinity. It's who we choose in life to help. So
Great.
I'm going to move on to the master plans, and so that we have time for more questions. And I just want to point out that the master plan for aging, that was now given out by the governor, was 2 years ago, or well, yeah, almost 2 years ago now. The governor said that we needed a master plan for aging, put together a stakeholder advisory committee. The committee had numerous meetings and came out with a plan with suggested recommendations that were then given to the governor's office. And then the state um, advisory committee came out with what was the final master plan for aging, which came down to 5 bold goals, as they like to say, and 23 strategies to build a what I like California for all. And so this plan is one it's a 10-year plan, it's a dynamic plan. And by California for all, it means that while the focus is, if you think of California master plan for aging, that means it's across generations. It is a generational plan, so that the goals and what we're doing is making aging in California something that can be positive. no matter what your age is, but clearly some of the focus is obviously for older adults, or it's largely for older adults. And it has a data dashboard so that we can hold the policymakers accountable and we can see how services are being improved for older adults. And it includes a local playbook, which I think is very important to download and see how each of us in our own communities, the local playbook says what you can do by cities and your local communities, your local counties, what you can do locally to follow these five bold things and goals in the master plan. So the first goal has to do with housing for all ages and stages. And this is really where it says that we want to be able to choose the communities where we want to age. And we want to be able to age well, whether we have a disability, or whether we have dementia, and that's also safe during major disasters. And so the goal for this is to have millions of new housing options so that all of us can age well across time. Obviously, I'm not going into this, it goes much deeper, but I'm just letting you see the main bold goals. The next thing is healthcare really reimagined. And this is so that we have access to services that we need so that we can live safely in the community, that we can optimize our overall health and quality of life. That doesn't mean that none of us will get sick or anything, but it's wherever your health is, you want to optimize it. And we also need during this goal, they really want to close that equity gap in and increase life expectancy across the board for all communities. Goal three, and the reason it's very crowded is this is the goal that specifically calls out the village model for as a something to build off of for the goal of inclusion and equity and non-isolation. So over time, it's very important that people have the opportunity to work, to volunteer, continue to be engaged, and be leaders in our community and be safe from discrimination and abuse and exploitation. And so the goal is to really increase life satisfaction as we age. And within that, they said to really promote and adapt the village model for older adult volunteerism and service and build on the strengths that are within California's diverse communities. And so under that, they pointed out that percent of adults who are 60 or older, their goal will be to report that they have more volunteer work or community service than they had in the past. So that's how they're going to be measuring it. So goal three calls out the village model. Goal four talks about caregiving that works. And that's really, there are a lot of things, but part of the goal is to have 1 million high quality caregiving jobs and also being prepared for and supporting caregiving throughout the state, throughout the lifespan. And one of the things under that goal that we're trying to work on is to continue to fund and have sufficient funds for the California Caregiver Resource Centers so that we can meet the goal of one of the sub goals was to have regular assessments for the caregiver and to help people prepare to meet the challenges of caregiving so that families and friends have a wraparound support service. And so we want to advocate for maintaining the funding for the California Caregiver Resource Centers within to meet goal four over the years. And then goal five is affording aging so that we have economic security for as long as we live. And we want to also close that equity gap to increase our elder economics security. And so within that affording aging, that has a lot of information around long-term care services, being able to afford health care services, afford housing, all of those things are there's just a lot underneath all this. So I would say if you can go on to, if you just Google the words California Master Plan for Aging, it will take you to this wonderful website that has, and then you kind of click on all the little plus signs, with all the recommendations, and you can also download the local plan. So there's a lot for advocates to do for the next 10 years. And remember, it's a 10-year plan. So not everything's going to get done within the first couple of years. There are already some things in there that are in the current budget to be advocated for advocacy for this year. Clearly, our goal this year is to advocate for continued funding for the caregiver resource centers, their funding strategies around housing, and incorporating the village model. So I'm going to stop here and say thank you for listening to me.
Thank you, Dr. Benton. And again, you I so appreciate this relationship with you and look forward to building it over time. A couple takeaways for me. I think the primary takeaway for me is that villages are an important part of the caregiving world, and that we can and should see ourselves that way, and that as part of that world, we have partnerships and resources that we can develop. And we also can develop potential funding relationships. And we've talked about that, you and I, Donna,
Right.
moving forward. So that's one takeaway. Another thing I wanted to let people know is that I did speak with the senior staff of the California Department of Aging last week about this goal that we have that Donna shared with you around the villages. And this goal has a timeline, 2021, 2022. So I'm thinking it's likely the upcoming fiscal year, which starts in July. And I'll be working with the state to really flesh out what does it mean to promote and adapt the model, and how do we partner to do that. And the California Department of Aging is recognizing Village Movement California as the leader in California. I know Barbara Sullivan is on the call, and there is a mention, a reference to the Village to Village network as a national and international resource. So we're in the plan, and that's excellent. Donna, do you have any suggestions for how we might move forward to advocate for this particular goal, adapting and promoting the village model? Any thoughts about that?
I think, I mean, you certainly have taken the first step already in reaching out to the Department of Aging. Within each goal, it'll say what department in the state is responsible for trying to move that goal forward. I think that hearing from members of the community is very important when you do set up meetings at the state level, and finding your local legislator to help continue being supportive of doing this adaptation, and then try and getting funding so that you can do replication. I mean, you guys already have a beautiful model. You have materials that help people replicate that model, and then making those partnerships. I'm glad that you said that, you know, one of the partnerships can be around the seeing it as a caregiving piece within the model, and making those connections so that legislators, the Department of Aging also makes that connection, because sometimes people don't think of how much this is a caring community, and how the three statewide systems could work together to strengthen this caring community across the state by having strong ties and referral sources together.
Right.
And, you know, one of the things with the caregiver resource centers is, as you said, you know, we want to make this a referral source, is that I can come back and we can set up like how we can have our own referral network. We can work on support groups together, so that we can make sure that the support group leaders are trained and understand how to link within their own community, so that it becomes a very smooth and warm handoff between the support group and the support programs. and how you can encourage people to use, because it's very hard for people to reach out for help. They trust the village, and then now you're saying, oh, there's this other place that you can trust. And so you have to, it's helpful to say, how are we going to build that partnership to make that trust work across the board?
Great. And there's some excellent comments in the chat, including the support under the Administration for Community Living under the Biden administration, and effort and a focus on caregiving. We're going to be seeing more resources coming forward. And I think in partnership with Village to Village Network, our national organization, we'll be able to promote and secure some of those resources for our village movement.
Right.
Also, Area Agency on Aging is another resource. And there's a lot for us to talk about, I think, with the local plans and how we can take the master plan for aging and then look at our local community and strengthen the village presence in the aging continuum. So I'm gonna share my screen again, and I just want to again thank you. Oh, excuse me, I went to the wrong one. Thank you for coming. I want to tell you about our 3 upcoming workshops. All of you were invited, members, volunteers, friends of the village movement. So on February 18th, we're going to talk about caregiver support groups, and we're going to hear from several members of the Pasadena Village Caregiver Support Group about their journey together and how they're supporting each other, particularly during the pandemic. And we're going to look at a toolkit that Village Movement California and Pasadena Village has built together. And we absolutely will be including more of this information about the caregiver resource centers in that toolkit. We do mention them. And Donna, I'm really going to take back this. One of the resources could be the support of facilitators and members of a village caregiver support group. So that is on February 18th at 10 a.m. Then that's followed in March by caring for someone with dementia. And we had at least one comment about caregiving for loved ones with dementia. And Donna, you talked about the large number of caregivers who are supporting loved ones with dementia. So we're gonna have Wayne April, who is a geriatric social worker with the Pasadena Village, talking about caring, and he brings a lot of humor, and that's always needed. And then our last webinar will be in April, and Barbara Kivowitz, who's up in the Bay Area, she does work, and she's written a book around how caregiving impacts the relationship between the caregiver and the care receiver, and strategies for managing the impact of caregiving on that relationship. So we're going to have some excellent content, which we will record, and we will share slides and the resources and links that come out of each of these. So I want to thank